I have the pleasure of serving as the liaison to the Board of Governors Grassroots Advocacy and Engagement Workgroup. And this is one of the many work groups of the Board of Governors, which, as many of you know, is composed of governors who are fellows of ACS selected to represent and lead their various chapters. And these governors serve on various work groups and committees. This one is a work group of the advocacy pillar and consists of about a dozen or so governors from around the country who really care about making sure that our advocacy is not just top heavy and only aligned at the federal level. And in fact, a lot of what we do is at the state and local level. We need to make sure that to be the most effective we can as a college, that our advocacy represents what's happening on the ground. And that's the grassroots part of the work group's name. And so in order to do that, the work group relies on members of fellows and RAS members at the ground who see what's going on in their hospitals, in their communities, who see what's happening in their local jurisdictions and state politics, and who can feed that information and those concerns up through our work group and through their chapters, so that then ACS as an organization can act on their behalf and can reflect their needs as well. So here's the roster for the committee. Our staff liaison at the college level is Emily Collada. The work group has two primary functions. First is to enhance the bi-directional communication between the college and its leaders and the fellows at the grassroots level regarding important legislative and regulatory issues. So this could be things that get in the way of your being able to perform adequate and independent practice of surgery. Things like prior authorization with insurance carriers and other regulatory burdens that delay care or delay necessary care. Things that get in the way of surgeons being the best they can be, things related to workforce, access to care, burnout and wellness, professional well-being and longevity, career longevity in surgery, and the larger society. How can surgeons be the most effective at what we do for medicine in general? And how can surgery be part of the House of Medicine to ensure that our specialties are represented in those wider health policy discussions? And the second major objective is focusing on the grassroots process to advocate for key policies at the local level. So the college is interested not only in what's going on federally, although that is important, but often when the federal level is slow, when Congress is slow to respond, which is true for most things, often there's a lot of activity and a lot going on at the state and local level. And that's why the local grassroots in advocacy engagement and ensuring that state advocacy is occurring at the chapter level is so vital and so important for all of us to understand what's happening in our local communities and jurisdictions. The way that the work group really operates is in a two-pronged way, both at the college and at home. At the college, the work group organizes many advocacy-related sessions at Clinical Congress, at the Leadership and Advocacy Summit, and other important college events. So some recent sessions that you may have seen at Clinical Congress include a town hall on surprise billing and how that legislation came to be and its impact on practices. A recent Stop the Bleed panel advising fellows and college members how they can implement Stop the Bleed in their communities, how they can be champions for such an important piece of program related to trauma. And then Beyond the Bedside, a Surgeon's Guide to Advocacy. So this was more of a panel session about how surgeons can empower themselves and be the most important advocates. And as Dr. Essig has mentioned, we've taken pieces of that and implemented it into our monthly Advocacy and Issues Committee meeting. So every month, our primer series on being an effective advocate goes over some of those essential knowledge and foundational tools you need to be an effective advocate as a RAS member. It also includes the State Advocacy Grant Program and the Advocacy at Home program. If you weren't aware of these are important college-wide programs that help to support local and state level advocacy. And it's really a lack of awareness that often allows these grants to go unused and unclaimed. So this is an excellent opportunity for RAS members to get involved and to get involved at their local and chapter level, where often there's a huge opportunity for RAS members to have a voice and to maximize their effectiveness and to work with their chapter leaders to apply for these state advocacy grants and these Advocacy at Home program, which is intended to bring lawmakers and legislators back when they're in their districts, either from the state capitol or from Washington, D.C., to meet with local leaders, to meet with surgeons, see what actually happens in a surgical practice and where those pain points are. On the other hand, the work group also has several activities at the home level, at the local level, and this includes grassroots engagement with governors, chapter governors, and chapter leaders, amplifying local needs, challenges, and pain points. So it's only through the voices of the people who are working in these communities, our own practices, the people we work with, our own patients, that we understand and we can feed up through the college, through our work groups and through the Board of Governors, what's going on and where we need to best place our advocacy. And then finally, by leading in-district meetings with legislators, so that the best time and often the most effective time to meet with legislators is when they're back in their district, right? When their day is not jam-packed full of meeting with constituents and lobbyists, going to hearings and committee work. When they're back in their district, that's when they're there to hear what's going on, to meet with constituents, and often at their most relaxed and able to understand what's happening. So this work group had our most recent meeting just yesterday. So I come to you today with active opportunities for engagement. There was a renewed call for engagement and connection with YFA, with RAS, to make sure that the voice of trainees and young surgeons is felt through the Board of Governors, and to make sure our work is amplified. So what are these opportunities? We can amplify the needs and concerns of RAS members to our local governors, and they're often best positioned to respond, to know what resources are available, and then to feed our voices through the Board of Governors to the college and influence college policy making. We need to maximize use of the state advocacy grant program. There's a link there which we can help distribute, because that state advocacy grant program is well funded and is available to every state chapter and every member of the college. We can help participate just by being there, using our voices, participate in in-district meetings, chapter advocacy events, state lobby days, and advocacy at home events. There's no wrong way to get involved, and there may be you might have a specific idea or a way that you feel most comfortable getting involved, whether it's an in-district meeting, whether it's participating in your state lobby days and going with your chapter to the state capitol, or participating in an advocacy at home event. Whatever the right way is for you, your voice is very much needed, especially at the grassroots level. And finally, collaborating with RAS on clinical Congress proposals. The more we can collaborate, the more our needs, our interests, and our advocacy priorities can be heard at Clinical Congress in such an important platform. So these are ways that the work group wants to hear from us. Will continue, of course, to serve as your liaison to work group and to make sure that the things that we're talking about, the needs that we have, and the ideas that are of the greatest interest to RAS members gets to the work group, and ensure that the grassroots advocacy engagement really represents all of us at the grassroots level.